We'd like to thank Ural Pharma for sponsoring this episode.
You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Pharmacists from across the nation have come together to redefine the possibilities of what pharmacists can do together. The American Pharmacists Association's 2026 annual conference was hosted in Los Angeles, California, where pharmacy advocacy and advancing technologies brought together key industry leaders. The Pharmacy Podcast Network brings you into the conversation with this special three-part series of the APhA Annual Conference Post Show.
Hi, I'm Jeff Gonzales, a pharmacist with Trinity Health Mid-Atlantic, and this is the Pharmacy Podcast.
Jeffrey, welcome to the coverage of the 2026 APhA here in Los Angeles. It's so good to have you.
Thanks for having me. This is an awesome opportunity.
It is an awesome opportunity for us. We learn so much from interviewing people at the conferences because I get a cornucopia of different views and things that are happening. So right out of the gate, what do you think the most important thing as a takeaway of the APhA 2026 for listeners that might not have been able to attend? What's one of the most important things that came to light when you've been here?
Yeah, so I think that's a great question. One of the things that I realize is that we are in this time of transition with the profession, and there's so many different moving parts, and it was very refreshing this morning to be at the general session, and the theme that I took away from that, and the theme of the conference is redefining what's possible. Mm-hmm. What I'm realizing, looking back, so I started in pharmacy in 2003 as a technician, and what I'm realizing is that the profession has changed so much. I'm in a job now where that didn't exist back then. Mm-hmm. And we don't know what the next 3, 5, 10 years will hold. So there's so much opportunity there. It's just what really is the limiting factor is your imagination. And that's really what I'm taking away from this conference is don't hold back and don't hold yourself back. Don't create these artificial barriers. Like if you can dream it and you have the willpower, you can achieve it.
Absolutely. There are digital platforms that have been created by pharmacists that are now businesses that came from the imagination of what pharmacists have done. Programs like MatchRx and RX Post and different technology platforms. AI has gone crazy with pharmacists dialing into how to actually use the systems to save time so they can be spending more time with patients. When it does come to AI, what excites you? What have you seen actually leveraged and in practice where AI is part of the solution as a tool for our pharmacists?
AI is amazing. What I'm seeing currently within our practices is the use of ambient AI to help with documentation. Which is cutting back on the need for our pharmacists and our primary care providers to spend that end of the visit just typing. They can focus more on patient care. I think that what excites me is that there's a ton of data out there, and for me, data always tells you a story. We as humans, I think there are stories that we can't conceptualize because we just don't know how to get the data to tell us what's the story that it's telling. Mm-hmm. And I think AI will enable that, just being able to utilize it to analyze the tremendous amounts of data that exist within, an electronic health record. I'm very excited to see what that happens, and to get inferences from that data where instead of being more reactive to disease states, being more preventative. So skating more to where the puck is going to be rather than where it was.
That's a really good point, and I agree with you. I've seen AI give our pharmacist organizational reference to large groups of population health level of information on one disease state, and now it's giving them reference to what the patient might experience on that specific drug. And I think I think of being able to be a specialty rare disease pharmacist and telling someone that's going to start a therapy, hey, listen, right around your 10th day, you're going to have nausea, it might come up. Well, if I'm prefacing what my patient's going to go through, there's less fear and there's less mystery, and then the pharmacist gets to demystify and put things into perspective, and therein lies why pharmacists, in my opinion, are so trusted. But I think in the hands of the pharmacists that are very consultative like that, AI is going to be so powerful to be able to reference stuff like that.
Yeah, absolutely. It's an exciting time for healthcare. And I was excited when I became a pharmacist and remain engaged in the profession. But the amount of change that I think is going to happen in a very short period of time is, I think it's breathtaking, and I think it's going to be for the better.
I do. I'm a half glass full kind of guy too, and I know that there's lots of struggles. There's lots of PBM reform that has to take place. We know we're going to have shifting in what positions our technicians are playing and how pharmacists are being utilized. But when it all shakes and bakes and it brings out, I think we're going to be in a new age of pharmacy, and I think that we're on an age of like you said, it's your lack of imagination of where you can go with your PharmD.
Yeah, exactly. I mean, if you would have told Jeff back in 2008 that he would be at a conference like this, and I mean, full transparency, I haven't dispensed a drug in 8 years. My job, I'm working side by side with our providers to ensure that we're taking the best care possible for our patients. If you would have said that I would be making my bones away from dispensing a product, I would have been like, how? You're out of your mind. But here we are in 2026, and pharmacists are doing just that, and we're on the front lines. We're helping, not that long ago, we were a major force in getting, righting the ship for the pandemic, with the mass vaccinations that we helped with, with people within the United States. It's, we're only limited by the power of our imagination and our willpower. We are constantly redefining what's possible.
That is a great plug for the 2026 APhA here. That's the whole theme of this year's conference here in Los Angeles. Thank you so much for being part of the show.
Thank you for the opportunity. This was great.
Maurice Shaw, Shane Jerominski.
Todd Uri, the Todd father.
The APhA 2026. It's so good to have you on the show. How are you guys?
Thanks for having us. We're good. Long days, but hopefully we're making a change, making the profession better. So
you are.
It's all about.
People are excited to see you here. There's energy that you've driven through all of the activity, the numerous of hours, years and years of content that you both developed, and then the merging of you together. And then now when you show up, when I'm always saying from a sales and marketing perspective, when you do online content, good content, and then you turn around and you show up somewhere, it really gels things, and it helps people to kind of layer up on what you stand for and what you're about, and people to really understand. So you being at APhA is very important, and just tell our listeners why you guys are here and what you guys do.
Sure. Well, you're absolutely right about that. It's different when people see you online and creating this content, but then when you show up at APhA or any of these meetings, it makes you a real person, and the people that have been following you for years actually do genuinely get excited to see you, because our profession is so difficult, regardless of what practice setting you're in, and we provide the comic relief as well as the advocacy work, and we tied that in together on social media, and we come to places like this to let students, pharmacists in every practice setting know that we're here to support them, and that, jokes aside, we're trying to change the profession.
Yes, we just want to see the profession improve. Like, yes, our focus is, safe staffing and unionizing pharmacies for better working conditions, but we sat and talked about PBM reform, provider status. We support the residents. I did a residency, so I go to the poster presentation. So, yes, we have a primary focus, but we just want to see the profession of pharmacy improve, and coming to APHA is one of the ways that we could show support, not only for what we're doing, but what other people are doing to improve the profession.
What I would say is that it's important for us to show up and learn things that we don't necessarily focus on. Maurice is absolutely correct. Ours is working conditions and unionizing, but what we've done here, like the only CE that we went to was Benjamin Jolly's session on PBM, on all the things that are happening with PBM reform in the various states. And it was great because that's one of the things that was lacking in our knowledge base. So now when people reach out to us, because RX Comedy and the Accidental Pharmacists have become places where pharmacists convene online to discuss issues affecting the profession. And they expect us to be the subject matter experts, and a lot of times I'll tell them I'm not. Yep. But I have connections because of places like this and the relationships we've built so that we can channel them to, if you want to know about PBM reform, if you want to know about specialty pharmacy, we can tell you where to go and get that information. And that's what I'm so glad that, along with doing stand-up comedy and all the crazy stuff that I get to do, we get to really affect change in the profession. That's the amazing thing about this, and that's why I'm so glad to be at APHA, and I would like to inspire all of those pharmacists out there that might be a little bit disenfranchised about big organizations like APHA, or pick your alphabet soup of all the different ones here. They need to be in these rooms and have these conversations so that we can change. Even if you are a pharmacist at a Walgreens or a CVS or anywhere, and you don't think the conversations that are happening here matter to you, I promise you they do.
They do. They very much do. And you keep bringing more and more transparency to different subjects, and you're doing it with authenticity, and you're doing it where you look at the camera as you're sitting in your car before you go on the shift, and you're doing it with sincerity, that you're like, hey, maybe I don't have all the answers, but here's what I'm feeling today. That goes a long way, and that's why that Shane, specifically you, not that Maurice doesn't do that, you're a little bit more, you bring more laughter in some ways in some of the content, but when you're sitting in the car and you're giving a frustration talk before you go to on a shift, that's resonating. That's something that people are feeling as they're watching the video, like, I'm going through that. And I think that's why you've made such an impact on the profession, is you've done it through sincerity, and you've done it because you've met the listener, you've met the follower where they are, and then you're turning it around, and then now you're able to educate. And it's taken a long time. How long has the Accidental Pharmacist been out?
So the Accidental Pharmacist page has been in existence since I started at CVS. Well, it was Target, back before CVS came in and ruined the best job you could possibly have anywhere in pharmacy. Target was the unicorn. People talk about Costco pharmacists as being the Cadillac of pharmacy retail jobs. Target was the best place ever. Yeah. And CVS came in and changed the culture and, of course, did that. But I had the page in existence for about 10 years now. But it's grown because of different things. People have been following for a really long time, but Kansas City walkouts, it was really the launch point of the advocacy work. Like, I always talked about bettering the profession, but it really was one of those things where we could seize the moment. We wanted to start a union. But let me tell you, from my experience now since the Kansas City walkouts, we never would have been able to do it if we didn't have the backing of an established union like the International Association of Machinists and Aerospace Workers, who put tons of resources to help us battle the giants of this industry. And that was really the key. They saw these are a couple guys that are telling jokes online and talking about pharmacy stuff, but all of a sudden I found myself on television next to Neil Cavuto on Fox Business and CNBC, and I said, that's when IAM stepped in and said, we want to help you change the pharmacy profession by fixing working conditions through collective bargaining.
So to give our listeners an update, let's talk about Pharmacy Guild for a second. Can you give us a state of the nation where we're at with Pharmacy Guild now?
Sure. So we've had pharmacists and technicians reach out in every state, in all 50 states. We have active campaigns in multiple states. We're currently bargaining contracts in Washington State with Save-On. We're bargaining a large contract with all the technicians at CVS Specialty Site in Redlands, California. We can, and 5 CVS standalone stores, some of the busiest CVSs in the country, in CVS's headquarters backyard in Rhode Island. We have the resources, thanks to IAM and IAM Healthcare. We have the resources to go into a tiny store that has 3 technicians and 2 pharmacists and unionize it. We also have the resources and capacity to unionize a facility with 500 people at it. IAM Healthcare just unionized Wexner Medical Center in Ohio. So we can do small or large. We have the resources and capacity to do that. Pharmacists asked for this to happen. I know they're afraid in some places because it's a very lengthy process to get to that first contract. But I'm very excited. I've been actively involved with Redlands because it's close to my home and I don't have to travel as much. I fly when I have to, when Maurice makes me get on a plane to go do a show somewhere. But if I can drive there, I'm getting in the Barbie car and I'm heading over. But so Redlands is very close to their first contract, and I'm so excited for those people that entrusted me. Some of them are going to get multiple dollar an hour raises on that first contract and can look forward to incremental raises for the next 3 years in the life of that contract. And the next one will be even stronger.
That's awesome. Maurice, what have you learned through this whole process and merging the social media influence you have with actually making needles move in the realm of the business of pharmacy and protections for our pharmacists and our techs and everything that you've learned through this process?
I've learned that, especially coming to APHA, the impact that unionizing has had on the profession, not just in the retail setting. I was talking to somebody today from academia that's, a lot of people in academia, they're worried about their jobs because enrollment keeps decreasing, mainly because, 1, the cost of pharmacy schools, but 2, also the terrible working conditions. People don't want to work in retail pharmacy. So by unionizing, they have all come to show support that hopefully if we can improve the working conditions, more people will want to go to pharmacy school, which will help people keep their jobs and even create more jobs as more people want to become pharmacists. I had to renew my license in Illinois this year, so I was doing my CEs. And whatever topic you pick your CE on, the very first paragraph is just about how many people are undiagnosed, how many people are undertreated. So there's a need for more pharmacists. Yeah. It's just the working conditions are terrible. People don't want to become pharmacists anymore because they know of the stigma of the working conditions are terrible. So it was just nice to really see that we're making an impact not only in the retail setting, but also in academia as well.
That's cool. That is so freaking cool. Shane, can you share the story of what happened here at the conference and kind of some things that you shared on online?
I shared a little bit on social media. I can't really go into it, but when you're getting a call after the first night of the opening expo and your phone rings and you look down and it's Dr. Michael Hoag's name comes up on your phone, you know you've made some impact here. But we've talked to APHA's management. It's been really great and supportive, and they do support pharmacists. I want to say that. So yes, they have to be
political.
Political and a mediator because big events like this require large sponsors. And I am not anti-CVS. Look at me. I got a CVS receipt on as a scarf right now.
I'm not anti-CVS either. I'm anti-bullshit CVS.
Yeah, we're not anti-corporation at all. We want to help them help themselves by treating technicians the right way so they stay enrolled, so they see a clear career path to be enrolled, because the only way to change this profession, Todd, the only way to do that is to make sure that you have technicians who are making livable wages, who stay enrolled once they have acquired a certain skill set. Because when they stay enrolled, pharmacists are given the opportunity to practice at the top of their license. Mm-hmm. Every organization, I don't care which one you are, all wants pharmacists to feel fulfilled in their career. That's why so many students are trying to go into doing residencies and working in different places, because they want to use what they learned in school. The biggest employer are places like Walgreens and CVS. We can do that job there too if given the resources and time to do it. Mm-hmm. And that's what needs to change. So I am, in a roundabout way, helping CVS elevate the profession by treating technicians like the key piece of this puzzle.
Yeah. And getting it out of fast food.
Yes.
I mean, pizza's not working. It's the original way of thinking of, come on, let's raise up. Let's do something that is good for the patient by doing what's good for our employees, what's good for the pharmacists, what's good for the tech to grow their careers in something that they want to be in. They don't want to leave, and they're leaving because they're sick of it. They're getting burn out, and it's based on a system that's like churn and burn, churn and burn. It's all about the volume. It's all about the money, and it's just like, unfortunately, it's where we're at today. And I'm big supporters of you. You're always welcome to use this platform and any of our podcasts at all, and everything that you're doing. Talk to us about where you're showing up live in some of the events, because Maurice, I know that you're bolted into a comedy group that's going kind of on tours. And are you guys showing up together? Other than I know APhA tonight, actually, you'll be doing a show.
Yeah, so we do tours together here and there. Maurice and I, separate from his big tour with lots of first responders and firefighters and all that. So he's on a healthcare tour called Heroes Off Duty. You guys should check it out. He's doing amazing work. He's had viral videos that have reached like 50 million.
That's
50
crazy.
million views already.
On multiple platforms, probably 150 million total, but
Oh my Lord.
whichever platform. So it's exciting. You know, sometimes when I think back to the origin story of me getting fired for doing comedy into where I'm at now, sometimes it's just, God allows things to happen how it's supposed to. So it's nice to see like something that I've been working at for years finally come to fruition. So we have a show tonight at I always forget the name of the play. What's the name of the
Eastvale Theater.
Yes.
So we have a comedy show together, Pharmageddon 2.0. But we also have done shows in the past in Las Vegas, Niles, Michigan, and we have some planned in the future whenever you can get me on an airplane to go places. You guys have your listeners tell us where they want us to show up.
Yeah.
If any pharmacy school out there wants us to come, let us know, and maybe we can make it happen through the Pharmacy Podcast Network.
Yeah.
Yes.
Yeah. So we're trying to work on, I'm not allowed to say anything yet because it's not official, but we might have one in Kansas City. Not quite sure just yet, but when it goes official, we'll be blasting it out there for sure.
You had me at Kansas City and barbecue.
We love you guys. Thank you so much for everything you do. Shout out to the Doctor of Comedy and Shane Jerominski, and just hats off to making pharmacy great again.
Thank you so much.
Thank
Have
you
a
for
great
having us.
night, and pharmacy on.
Pharmacy on. This is a special APhA because the California Pharmacists Association is having their annual event merged with the APhA, and Richard Dang is here. Dr. Dang, it's so good to see you.
Hi, Todd. It's good to see you.
How long have you been part of the California Pharmacists Association? Because you've been actively involved with this for quite some time.
Yeah, I've been involved with CPHA for longer than I can remember, but I've been on the board for at least 5 to 6 years. I was a past speaker, past president, and then I've been off the board now, but I am the current chair of the legislative committee with CPHA.
You were involved even as a student, weren't you?
I was, yes.
That's incredible. See, there's something I want to give a shout out to listeners. Listeners, if you are not supporting either your state associations or your national associations, you're missing out, because there's so much education within it for not only your own career, but what you can give back to other people.
Yeah,
and I think you've experienced that.
Absolutely. It's a great opportunity to network and meet others and just learn about different career opportunities and build your own personal kind of branding and leadership skills as well. So it's been a really amazing opportunity. And yeah, just like you mentioned, I've been supported as a student, being involved in associations by other pharmacists. And so really grateful to the mentors that I've had in the process.
Richard, let's talk about standards of care. Let's talk about the importance of some of the things that the California Pharmacists Association is really working on.
Yeah, so last year, CPHA supported a bill, AB 1503, which was sponsored by the California Board of Pharmacy. And as a part of that, it was a pretty significant overhaul of the Pharmacy Practice Act in the state. And one of the elements of that was the incorporation of the standard of care model in the state. And we're seeing a lot of those a lot of that happening throughout the nation as well, but California being among the I think 4 or 5 states now that may have a standard of care kind of framework within pharmacy practice. Really exciting that California was able to adopt that. And what that really means for us is that we are now moving away from prescriptive and rescriptive regulations and laws that really dictate what pharmacists can and cannot do, which drugs you can furnish, which protocols you have to follow, what training you're required to have, and moving towards a broader framework, which is called the standard of care model, that more defers to the clinician's discretion and expertise. And so now instead of saying you can only prescribe or furnish this drug, it's that you can furnish a drug as long as you have the training, education, and competency and resources to do so, right? And so that's a really big opportunity for us because that really expands what pharmacists can do, and we don't have to rely on state protocols or state regulations to be able to be told what we can do. And there's advantages to that because with the state protocol, what we learn is that because it is so prescriptive, that there's not a lot of flexibility. And when a new drug comes to market or when a new guideline comes and have different recommendations, we have to spend years working with regulators and legislators to get that changed instead of adapting immediately. And the standard of care model will allow pharmacists to adapt immediately to the newest and greatest evidence.
If you take what you're building and we have it scripted out, we have the written form, we have even specifics depending on a disease state or whatever the standards of care is kind of overview. Do you think this will help to calm the scope creep of the AMA that always says rah, 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 and I'm like, every time they argue, I'm like, come on guys, it's not like that, because pharmacists don't want to be the physician. They want to be a pharmacist.
Right. We are looking to be members of the team, and even through the standard care model, we're not cutting anybody out. We are not overriding any physician orders. We are not cutting out the primary care providers. As a part of the standard of care, that is the expectation of collaboration. And so we will still be communicating with the patient's primary care providers to update them on what services we may have been providing. There's also a huge proportion of patients in the state who don't have access to primary care providers and don't have anybody, and in some cases, especially in rural areas, that pharmacist may be the only person that they can receive services from.
Exactly. And then I think of things like education from, let's say, contraception, and pharmacists being able to prescribe something like that. That makes sense when it's it's not being, you can't get a appointment with your physician to go down deep into what's going on, but a pharmacist could communicate some of maybe the difficulties back to the physician, and it's just like, okay, let's give the pharmacist the ability to do what they should be doing because of how many times they're in interaction with a patient in comparison to the physician.
Right. Yeah, and I think another element of the standard of care discussion is there's also this expectation for pharmacists to recognize their limitations and understand where their limits are and what situations warrant a referral back or communication back to another provider as well. So it's not just allowing everyone to do whatever they want, it's doing things that make sense based on your education and that make sense for your patient.
Dr. Richard Dang, so thank you so much for spending time with us here at the APHA 2026 open invitation to the California Pharmacists Association. Anytime you guys want to come on any of our platforms, we have 40 plus podcasts that it can drill down into a whole bunch of different things, but we'd like you to be more part of it. So open invitation to you guys.
Great. Thanks for having me, Todd.
Thank you.
As frontline healthcare providers, pharmacists like you understand the importance of personalized care, especially in acute pain management. Ural Pharma is dedicated to providing high-quality, generic products tailored to meet your patient's needs. The company aims to serve a diverse range of patient populations, including athletes recovering from intense training, weekend warriors managing minor injuries, and those seeking a practical and mess-free option for acute pain management. Keep Ural in your toolbox of pain management options and join the ranks of pharmacists leading the way in personalized care. To learn more about Ural Pharma and its products, including full prescribing information, boxed warnings, and important safety information, visit uralpharma.com. That's YARAL pharma.com, and connect with them on LinkedIn.
Marsha Millonig, Catalyst Enterprises, LLC.
Marsha at the 2026 APHA. It's so good to see you.
It is so great to see you, Todd. One of my favorite things about this meeting.
One of my favorite things is mixing in the intelligence that people like you bring to the listener base, and your years of research, your years of study, and you're a blogger at heart. Every time I follow you on LinkedIn, not only are you referencing an article, but you're kind of giving an opinion on it. That's how blogging started. I don't think people understand. Blogging was never about the individual's insight. It was about take a newspaper article and then give an opinion on it. And then that's how podcasts starting too, by way back in 2006. It was always based on something else.
Well, congratulations on 20 years of podcasting. That's pretty neat.
It's been crazy. It's been 17 years, and it's just been blew my mind of how many different sectors of things in pharmacy don't get enough attention. We're not talking about contraception enough. We're not talking about pediatrics enough. We're not talking about certain rare diseases enough. And I think podcasting gives us an opportunity to listen in to the expert and then put something else out there to stretch us. Because I don't want us to have all the answers necessarily, but I do want us to challenge each other.
I think that's important, and I think that's one of the important things about coming to a show like this. The theme here is redefining possibilities, but I think about it as reinvigorating and reconnecting too. And I think part of that reconnection is challenging us to find new things, and we learn from each other while we're here, and I think this is a perfect way to do it. So that's why I'm here. One of the other things that I'm excited about is recognizing people who have accomplished a lot. Again, I thank you for getting pharmacy such a big voice and such a big presence through podcasting. I really appreciate that. I'm also excited that we're going to recognize some of my Minnesota colleagues here with some pretty big awards at the meeting. So again, I thank you for constantly putting the focus back on pharmacy. So love that.
That's what it's all about. It's not about me. It's about you. It's about the pharmacist that's out there that's not getting enough recognition, that's not getting enough. I love taking the white paper or the journal article and turning that into a true discussion to get more insights to it, to drive more people to look into it, making people curious. My next there's two pathways of what I'm really after now. Number one is I want to go after the consumer. I want to get people that are talking about pregnancy or sexual health or HIV, and I want to demystify to the public how much of this is out there. So much TikTok, so much social media with bad information. And it's the pharmacist that can really become the barometer of what is real and what isn't, but then make it fun to listen to. And then my second, and something that you're kind of part of it's not official yet, but we're kind of baking the cake, is the role of evidence-based podcasting. And that means if I'm listening to a show that has that seal on it, I can rest assured that it goes through the same rigorous backlog and double checking and journal evidence-based referencing, that we can rest assured that what we're listening to is as good as it gets, and for the clinician.
Todd, I cannot thank you enough for pursuing these two avenues. My next blog, as a matter of fact, is about the misinformation that's often spread on social media and TikTok. And I just saw some pretty powerful data, and it came out through one of the journal studies, and that's what I'm going to focus my blog on. So being able to do a consumer focused area that provides them with solid information that corrects a lot of what they may be seeing on Reddit, TikTok, you name it. And then also the whole idea of evidence-based podcasting. I'm all in, and I can't wait to bake that cake with you.
I love it, Marsha. Thank you so much for what you do for our profession. You've been one of the original bloggers that's out there that I remember following 10, 15 years ago, not to age you, but you've been around long enough that we can reference what was, making things better. What is it about APHA that excites you, the changes that you've seen happen over the years?
You know, again, I think just the whole reinvigorating. I always walk away from this meeting reconnecting with people. My roommate this year is a friend of mine who hasn't been to the meeting for 10 years. I'm so excited she was able to come. We're enjoying doing it together. We're picking up on a lot of ideas, and it just really reinvigorates me to go home and do some other things. So it's my favorite part of the meeting.
Marsha, thanks so much for being part of the post show here at APHA 2026.
Thank you, Todd.
This is Dr. Walter Oronsaye, and you listen to the Pharmacy Podcast.
Walter, welcome to the APHA 2026 coverage here. How are you?
Doing great. Thanks for having me.
I've been looking forward to this interview for quite some time. You are a superstar in our profession, and I just think that it's interesting how people like you and Maurice Shaw and Shane Jerominski and Katie Forbes, how you guys have all risen in the realm of social media. And talk to me about that. What's that like to be somebody that's recognized and sought after and followed? And talk to me about that.
Well, it's really an honor. I'm very humble about it. So I'm glad I'm able to represent the pharmacy profession online, social media. Like I said, it's not many of us on these platforms. So the few of us that's actually doing it consistently, I'm just happy to represent. Always try to show the pharmacy profession in a good face. So. And then it's funny content. It's really good. It's educational content, and you're doing it through humor. And I think that's a perfect way of educating not only fellow providers and nurses and people that you work with, but the public to understand things. And there's some of your comedy and the sarcasm that I don't think people outside of the profession will get. Yeah. Because it's more for the pharmacist, it's more for the doctor. Yeah. But I love it anyway. It's over the head of the consumer. Yeah. I mean, so a lot of the stuff is a lot of inside jokes that people in the healthcare field kind of understand. But I always try to keep the content where the general public can kind of enjoy it. At the same time, probably learn something a little bit about what's going on in the pharmacy profession or in healthcare and just take away, come out and take away some information that they can use in their everyday life.
So something that's exciting for me, and just to share with the listeners, you've done so well in content development that you're able to bring in some income for yourself based on brand representation and things that you're doing. But you do it in a very educational way, once again, that doesn't seem like what all people would say, oh, that's a sellout or something. But no, you're doing it much more educational and much more transparent.
Yeah, so I mean, brand opportunities always come with, as you grow. When you have eyes on you, that's going to bring some attention. That's going to bring of course, going to bring the revenue and dollars conversation around. So, but at the same time, I have a profession. I'm a pharmacist. I want to make sure I uphold my profession, and make sure I'm respected in the pharmacy community. So, I do look at collaborations. I always make sure I screen them with colleagues and make sure they're vetted. Make sure everything is always evidence-based medicine that I always want to support too. So that's a big factor of those brand deals.
What sector of pharmacy, just for listeners' background, talk to us about your background as a pharmacist. Where are you practicing, and in what sector of pharmacy?
So I did practice community pharmacy. That's what I did for the most part. I'm currently in medical school right now too. So I did a master's in biomedical sciences a few years back. And just the community pharmacy setting, which I enjoy doing because that patient interaction, we're kind of the first stop that patients come to, at any time. So that part of the pharmacy setting is where I enjoy the most.
In becoming a physician and going to medical school, what sector of healthcare do you think you'd like to gravitate towards, having a PharmD and an MD?
I just like the community setting. I'm still kind of figuring out what I would like to specialize in, but I do like the community setting. Like internal medicine, family medicine, just kind of being that person that patients go to, that their kids could go to, their parents could go to, and just kind of being that person in the community that they could always count on. That's what I enjoy about pharmacy and medicine as well too. So
why'd you show up at the APHA? This is an important conference for us as a publication because it's kind of like the center of our profession, and so many people mix up. But why'd you come to APHA?
Oh, APHA, that's like the Super Bowl of pharmacy. Yeah, so everything is here. Everybody is here. This is where, decisions gets made. This is where policy gets changed. So I think it's important that all pharmacists and students and people involved in pharmacy try to make it out here to affect change. Because you can't always just complain about what's going on. You have to be here to make that change happen.
And originally, your name was, is it the Fit Pharmacist or Fit Pharmacist?
Yeah, PHIT, Fit Pharmacist.
Fit Pharmacist.
Play on words, get it?
That's right, PHIT.
PHIT.
That's right, the Fit Pharmacist.
Yeah.
Now, you spent a lot of time bodybuilding and your own physique and things like that. With your time of everything that you got, medical school, you're doing brand deals, how has that impacted your exercise?
Well, so I basically don't sleep at all. I just stay up. I stay awake 24/7. So that's the secret. That's the secret, guys. Just don't sleep at all. But I'm just kidding. But it's just about prioritizing what's important to you. I want to prioritize my fitness, and that's the same thing I want to preach to my patients too. You have to prioritize fitness or health and your mental health, your well-being. That should be priority, because if you don't have that, you don't have anything. So it's not always about chasing money or chasing this and that. So if you have your health, you have everything else. So that's one thing I don't want to compromise on.
Absolutely agree with you, Walter. This has been exciting for us to feature you here on the 2026 coverage of the APHA show. I'd love to have you on This Week in Pharmacy at some point too. So we have to have you back.
For sure. Thanks for having me, and you're doing a great job representing the pharmacy profession and representing APHA. Hopefully they'll put you on more and do more of these things. So
more and more.
Yeah.
Thank you.
Yeah, thanks for having me.